Good evening, one and all.
Good evening, madam.
Yeah, hello, good evening, ma'am.
On behalf of Chalapati Institute of Pharmaceutical Sciences and Enrich Startup Center, I would like to invite Mr. Sachin Kamboje Garu, CEO, OPEX Accelerator Private Limited, to have a student orientation program on healthcare startups. We would like to welcome you, sir. So please start the session, sir. Actually, Principal sir was busy with some other work. Sir will join shortly, sir.
Okay, fine. Not a problem. Yeah. So thank you so much. Before I actually start this session, I just wanted to know whether I am audible to everyone.
Yes, sir.
Yes, okay. And whether my PowerPoint presentation is visible to everyone.
Yes, sir.
Yes, sir.
Yes.
Yes, sir. Yes, sir.
Yeah. Okay. Just a moment. The students, those who are watching on YouTube, please let me know if I am audible as well as I am visible to everyone. Please type yes in your live chat box so that I can see whether I am presenting this particular slideshow with you. So please check before I actually start this session. The students who are there on YouTube.
Yes, sir. Even in the YouTube also it is audible for.
Okay. Perfect. Just a moment.
You can please start the session, sir.
Okay, fine. So first of all, I would like to thank Dr. Rao sir and the entire team of Chalapati Institutes. And this is particularly the first program for the all the students. And as a part of this program, I am going to orient you everything about startup. All the questions which are related with startup, like why startup, what startup, and how to start a startup. So eventually this is a process, but before we actually discuss about the process, like how to start a startup, first of all, let's begin with why we need such kind of startups. So even I appreciate the entire faculty member of this institution because they are taking the efforts for these kind of programs, because the culture of startups and the culture of entrepreneurship is there in engineering institutions or management institutions, but hardly we can see this kind of culture or the environment in case of pharmacy institution. So I really appreciate all the efforts from principal as well as all the faculty members. Eventually most of the students, most of the PG students, they have their innovative ideas through which they can actually get into the journey of this particular startup. So before I actually start this, I just wanted to introduce myself. I am Sachin Kumboje, and I am basically founder of OPEX. So OPEX is basically a short form of operational excellence. And what we do in OPEX is we handhold all these institutions, we handhold professionals and student startups so that eventually they can start with their own startups. So in this journey, we came across with multiple institutions, multiple universities, and as a part of this, we have n number of programs, orientation programs, some boot camps, some ideathons across various institutions of our country. Okay, now in view of this, the presentation which I am sharing is startup orientation program, and especially this is a healthcare startup. So here, as a part of, again, if I want to share my entire journey into this, is even I am a pharma professional. I did my B Pharm from Bharati Vidyapit, from Shivaji University, Maharashtra. Then I did my M Pharm in pharmaceutical chemistry. I worked in industry for nearly 3 years in technology transfer department in multinational pharmaceutical company. Then I switched my career, and then I chosen a path of management like MBA. I did my MBA, and later on I could start my first startup in 2016, and right now till date I have my own three ventures, out of which two are into edutech and one is into organic food. So this entire journey, because I'm a pharma professional, I could see that the healthcare startups, Now, we all are actually experiencing the impact of this pandemic. And it is clearly said that in the next 5 years, the number of healthcare startups in India are going to rise like anything. So right now, if you could see the number of healthcare startups, we have some simply 9 to 10% of the startups which are into healthcare. And even we are going to see in detail about that part as well. So when I say healthcare startup, now this session, when I deliver for pharmaceuticals, now we all have to consider pharma as one of the part or one of the entity of entire healthcare system. Now when I see pharma is a part of this. So healthcare, when we call healthcare, this is entire sector, and out of which pharma is one of the part, pathology is one of the part, diagnostics is one of the part, medical devices is one of the part. So we have some subsectors, and pharma is a subsector. So when you think for a startup or when you think for entrepreneurship, why not you think for entire healthcare sector? So that is my first suggestion, first advice to you all, those who are listening this particular session. So you should consider pharma as one of the sector, or one of the opportunistic sector to start or to begin with. Now, again, the opportunities which are linked with healthcare startups are huge, absolutely huge, because we all are Indians, and fortunately, unfortunately, we know right now, we know the limitations of Indian healthcare system. During this pandemic, we could identify the gaps in our Indian healthcare system. And if you could break this system, if you could disrupt this market by using a technology, then that could be the finest startups in our country. So idea is basically, being a pharma professional, you all, or we all as a pharma professional, we should think that what kind of problems are there in healthcare startup and how I can solve these problems. So my session is all about healthcare startup. So my session is divided into three parts. First, I'm going to share you the Indian startup ecosystem. Number two, I'm going to share you some of the finest case studies about healthcare startups. And last part, I'm going to share you some of the pain points of our healthcare startup or our healthcare system, so that you as a professional, you as a student, you as a researcher, you as an innovator, you can ideate a solution for our healthcare system or for our healthcare gaps. Okay, so we'll begin with this. So now, just a moment. Now let us first understand what is startup, because most of the students, they cannot, right now the startup, it has its own boom, or we can say like startup has been glorified in India, no doubt, but most of the students, they don't understand the real meaning of startup. No doubt, startup is a business, but startup is not about traditional business. See, if you are simply doing a trading business or a retail business, or if you're selling into in some supermarket, or if you have a franchisee of, say, Apollo Pharmacy or something like that, it cannot be a startup. So first understand what is startup. So startup is any business which involves innovation. So the businesses which are linked with innovations, they are nothing but startups. Okay, so now I want to see, because we should make it more interactive, I want to know from your end, please tell me the examples of startups which are there in India. You can use chat box of Zoom, you can use chat box of live chat box of YouTube as well. So I just wanted to know from your end, tell me few of the examples of startups which has innovation. You can use chat box. Let's make it more interactive. You can use your chat box. Yes, go on. I can see some of the answers here. Mobile canteens, okay. Urban ladder, perfect. Pharmacy. Okay, research articles. Okay, we'll get back to you on this because we are actually discussing that as well. So urban ladder is perfect example. Farm is perfect example. Mobile canteens. Okay, what else? What else? Please go on sharing all your examples here. Let's make it more interactive. Or you may came across some of the startups which has a pharma background, like what we can see farm easy. Okay, so similar kind of startups, even those can be in examples. Even forget about healthcare system, tell me some of the great startup examples for our country. Vaccines to various diseases that are not yet discovered. Okay, 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 okay. Yes, please go on. Please share whatever you know so that I can, share you more on that. Yes, I want to see maximum examples from your end. The best startups in Indian startup ecosystem. I want to see some of the examples of those. Yes. Okay, okay. Moving ahead now, in that case, if I want to share you the best examples of startup which we have. Thank you so much, Mr. Krishna. Byju's is the best example. White Hat Junior, yes, perfect. These are some of the examples, great examples of startups, right? So similarly, we have Flipkart, we have Byju's, we have White Hat Junior, we have Paytm, we have Oyo Rooms, we have Swiggy, we have Zomato, right? So these are all the exceptional startups which our country today has. And each and every business, they have innovation. Now, what we know about innovation. So let's discuss first about innovation. So first of all, understand one fact that as we are all from science background, there is a clear cut difference between invention and innovation. We are focusing more on innovation, how innovation can be commercialized. This is the entire story, how innovation can be commercialized. Now, even we have seen excellent startups, or not startups, we have seen excellent innovations even from faculty members, those who are working in pharmacy institutions, medical universities. They are having exceptional innovation. Those can be seen in their research articles or in various journals or in their conferences or presentation. But they are stucking, or they are leaving behind this particular research or innovation work till just conferences and presentations. That's it. There is a world behind or beyond this particular presentation and publication, and that is how you need to commercialize your innovation. If you are doing, or if you are innovating something in cosmetic formulation, if you are innovating a new formulation in herbals, so besides your publications and presentation, what you nearly or really think about is how your innovation can be commercialized and can bring into the market. And that is what is all startup about. So startup is basically starts with innovation and it ends with business. So here you need to see how you can commercialize your innovation, how you can commercialize your research work, how you can commercialize your publication and presentation. And in this entire process, what you need to really see is how your product or your service can actually solve the customer's pain point. Now, this is the core of any startup, that is solving customers' pain point. If your product or your service is not solving customers pain point, then ultimately you cannot see the sales cycle, or nobody is going to buy your product. See, unless and until now I am your customer, and unless and until I have some use of your product, why should I buy that? So again, you cannot scale your startup, you cannot scale your business, and that is why startup is business with innovation. Now, moving ahead, we are now going to see Indian startup ecosystem. Now, as a part of this Indian startup ecosystem right now, what we know is the officially recognized startups. So right now in India, we have more than 38,000 officially recognized startups, and our two startups are one of those. Okay, so now what is the meaning of recognized startups? Now, as we all know, we have a campaign known as Startup India. So Startup India is basically being operated by Invest India Federation from the central government. So, and Invest India Federation, it comes under Niti Aayog, the Planning Commission of central government. So Niti Aayog has this Invest India Federation, and Invest India Federation has the campaigns like Make in India and Startup India. Similarly, Skill India is there, which comes under a part of MHRD, right? So these are some of the campaigns which are run by the central government, and right from 2015 we could see Startup India is running exceptionally well, and today we could see we have more than 38,000 startups in our country. Now, what do you mean by officially recognized startups? Now, when I say officially recognized, here the thing is you should have a recognition from government. Just a moment, I can share you one of the certificate of recognition. Just a moment. Yes. Can you see the certificate? This is certificate of recognition. Please type yes if you can see the certificate of recognition. This is just for your reference. Yes, please type yes if you can see this certificate of recognition. Yes. So certificate of recognition, this is basically certification from Department for Promotion of Industry and Internal Trade, which is under Ministry of Commerce and Industry, Government of India. Now, this certificate has been issued to our company in 2019 by central government. What it states is this recognize that your business has innovation, right? And because your business has innovation, your company or your business has been recognized as a startup. Now, here, directly or indirectly, I cannot get the funding from state central government or from Startup India. Here, I am going to receive only certificate of recognition, and I am going to use this certificate of recognition for all my other tasks like fundraising or bank loan, or for any other tasks which are related to related with my business, so that the credibility of my business will going to enhance by using this certificate of recognition. And this is how government recognize your startup, your entity, for your own innovation. So that you need to understand before you actually go in detail about startups. So this is how government recognizes these startups. Now, when we see these number of Indian startups, maybe 4 years back, we had only 516 startups, only 516 startups in year 2016. But the level of which we all are working towards the startup in year 2018, we could have more than 8,000 startups, and today we have more than 38,000 startups. We are right now the third largest ecosystem in on this entire planet. Third largest startup ecosystem. Number one, of course, is US. Number two, of course, is China. So right now today, US has more than 1 lakh startups, right? And similarly, even for the next 2 to 3 years, we are actually marching towards the target of 1 lakh startups in our country. Now, out of this 38,000 startups, let us now see where all these startups are located in. Okay, so now when I see sector wise distribution and state wise distribution of all these startups, I have some facts and figures. Now, state-wise distribution, if you could see all these startups, Maharashtra has majority of the startups in their state, but city-wise, when I consider, Bangalore is the number one where we have largest number of startups. So Bangalore is a Silicon Valley for our country as far as startups are there, or we can say startup capital of India. Next to Maharashtra is Karnataka, then Delhi, Uttar Pradesh, and then Telangana. So these are the top 5 states where we have highest number of startups. Now, sector-wise distribution, as I said, as I told you earlier, 15.2% startups are in IT services, while 9.1% startups are in healthcare. And in the next 5 years, now because of this COVID-19 pandemic, we are expecting in the next 5 years, majority of the Indian startups would be in healthcare. So this statement itself is an opportunity for all of you. Being a pharma professional, you can sense the opportunity which is there in our entire healthcare system, and you could create, you could innovate the solutions for whatever gaps we have in the entire healthcare system. These gaps can be in hospital management, this gap can be in diagnostics, this gap can be in pathology, this can be in reports, documentation, health insurance, pharmaceuticals, vaccines, biotechnology. It can be anything, and we are going to see that in detail as well. Next, 7.6% is augmented reality and virtual reality. 4.4 next is food and beverages. 3.5% finance, 3.4% retail. Green technology 3.3%, renewable energy 3.1%, IoT 2.8, real estate 3.6, AI 2.6, analytics 1.2%, robotics 0.8%, and education 0.3%. Moving on to, as I said, India is the third largest startup ecosystem, and US and China are the number 1 and 2. But the country which I'm going to mention is doing exceptional thing in the world of startup, and that country is nothing but Israel. So the Israel, now this country, a tiny country which is coming with excellent innovations in agriculture, they are doing exceptional job for this entire globe. Now the level of innovation, the level of technology which right now they are using in their startups in Israel, they are remarkably good. Okay. Number 2, India is right now home to 32 unicorn startups. Now let us understand what is unicorn startup. So unicorn startup is the one for which the total revenue is more than $1 billion. And the best example for you to tell you about unicorn startup is Byju's, Paytm, Swiggy, Flipkart. These are some of the best examples of unicorn startups. Right now, India is home to 32 unicorn startups, 32. But today, US has more than 250 unicorn startups, which are above $1 billion. And out of which I could tell you some of the examples, like LinkedIn is one of that, Airbnb is one of that, Google is that, Facebook is one of that, Instagram is one of that. Now all these, even Tesla is one of that. So these are unicorn startups from US, from Silicon Valley, which has been crossed $1 billion revenue. So right now, number of healthcare startups in India are nearly 4,800 till December 2019, and we have this more number of investments in health tech startups as well every year. Total technology startups are more than 5,000 startups, and every year we have 2 to 3,000 additions in our total Indian startup ecosystem. Bangalore, Delhi NCR, and Mumbai, these are the 3 metro cities which form a base of 68% of total startups. So as you can see here, majority of the startups are in metro cities, but we all should accept the fact that grassroots innovations, they are actually playing important role here. There are few startup founders who are coming from villages, from tier 4, from tier 3, and they are coming with grassroots innovations, right? So we should consider this fact as well. Next, there are some 540 startups which are actually solving India's core problems. Now when I say India's core problems, then I have a list of examples like waste management, sanitation and hygiene, crime, pollution, population, women's safety, hygiene, sanitation. See, these are all India's core problems. But actually, we have only 540 startups which are solving India's core problems. Then next to this is active incubators and accelerators. Now we have 210 active incubators and accelerators, out of which 110 are there, which are government recognized incubation centers. Okay. Now, what is the role of incubation center and accelerators? Let us first understand that. Now, incubation. Now, probably you may have heard this term, incubation. So, yes, of course, we use this term for hospitals. So, whenever we see a premature baby is born, so what we do or what doctors do is they keep this premature baby in incubation or incubator. Now, why we keep premature baby in incubator is because the environment which that baby requires, a premature baby requires, that incubator has all that. So for the next 4 days, 8 days, for a week, for 15 days, we keep that baby in incubator, and after that, then that baby has that exposure of normal environment. Okay, this is the same story for startups. So when you have your ideas, when you have your innovations at initial level, so your startup is at baby stage or your idea is at baby stage. But if you are launching your idea directly in the market or prototype in the directly in the market, then again you can see early age shutdown of your startup. So this is where a role of incubation center is there. So at university level, at institute level, right now we have incubation center, startup center. So what they do is the startups, or what they do basically, they facilitate all the services for startups, right? Like even you now have ENRiCH Startup Center, as a part of which you are going to have incubation activities. Now, as a part of this, what you will have is, whenever a student or whenever a group of student is going to have some innovative idea in his mind or in their mind, what they have to do here is uh, they have to report to their incubation center or startup center, upon which whatever support which is required for all these startup teams, like they would require their idea needs to be validated, market analysis should be done, market research should be done, fundraising should be done, then networking should be done, then some prototyping has to be done, then they have to see how they can actually see their customers feedback for their working model at least. So this incubation center is going to have entire facilitation for the startups, unless and until they mature enough to launch their product in market. These incubation centers or these accelerators, they handhold, they mentor all these startups. Next to this, we have more than 1700 advanced tech startups like AI, by using AI, machine learning, big data, cloud computing. These are some of the advanced technologies, and there are certain startups who are coming with these technologies as well. Now, one more thing which we need to notice here is the average age of startup founder in India, because yes, as we are already aware of demographic dividend, that the average age of Indian today is 31 years. And if we could see that average age of startup founder in India is 28. So most of the youngsters from engineering, from management, from life sciences, from pharma, what they are doing right now is they are focusing more on entrepreneurship. They are focusing more on starting something of their own. Okay, and that is why we have more youngsters in the startup space. Now here you need to consider two things here, number two and number three. Number two is educational qualification. Number three is student startups. Now, when it comes to educational qualification, whatever startup founders today we have in India, 50% of these startup founders are engineers, 25% of them are MBA, and remaining 25% we are there, right? So life sciences, commerce, pharmaceuticals, they are there in this 25%. Now when I say student startup, now let us first understand, because this is the most important part for all of you student startups. What is the meaning of student startups? Student startup is nothing but students during their education in their second year or in third year, they whatever projects they have, whatever innovative projects they have, rather than just for the sake of submission or just for the sake of publication, rather than all these things, they see to it how they can commercialize their innovative projects into a marketable product. So culture is there in today in IITs and IIMs and multiple universities, and during this culture, even the students which are there in second year and third year, they are doing their innovation or innovative projects, and they are looking like how they can commercialize it and bring it into a market. So these are the students who are not talking about placements, they are not talking about jobs, they are talking about how I can start my startup, how I can start my own business at the end of my graduation. So this is how their mindset has become, right? So documentation is completely a different story. They are not doing all these things just for the sake of documentation. They really want to start something of their own. So that passion is there in students. And this student startup, number of student startups in India is rising each year by 30%. So every year, the universities, institutions, the type of or the level of ecosystem which now campuses or institutions are building with, we can see more number of startups in upcoming times to come. Now let us discuss about the second part of my presentation, that is the case studies of startups, the healthcare startups in a country with only one doctor per 1,000 people. So this is the irony of our country. This is the fact and figure of our broken healthcare system, right? In a country where we have only one doctor per 1,000 people. So you need to seriously think about this entire thing. Now, we have healthcare sector, and again, in this healthcare sector, we have some subsectors. So when I say healthcare startup, again, we have some subsectors, like online pharmacy is one of the sector in healthcare or one of the element in healthcare startup. So where you can start your startup in healthcare is either in online pharmacy or personal health management or home healthcare, fitness and wellness, telemedicine, diagnostics, biotech R&D, medical devices, healthcare IT, biopharma, genomics. These are the subsectors of healthcare startups. So eventually, you have to see where your innovation is there in which particular subsector, and based on that, maybe you need to include technology part for that as well. Okay, so let's discuss all these sectors one by one. But before that, what you need to target here as far as healthcare sector is concerned, either you should target affordable healthcare or preventive healthcare or portable medical devices. Now when I say healthcare startups, it can be anything: patho, physiotherapy, pharma, medical devices, diagnostics, surgery, medicine. It can be anything, but target segment should be affordable healthcare, preventive healthcare, and portable medical devices. Now you have to see which innovation you have, which idea you have, which research work you did, and it falls into which category, either affordable healthcare or preventive healthcare or portable medical devices. These are the three most demanded segments in our healthcare sector. Now let's discuss one by one and all the case studies of this. So these are some of the examples of top Indian healthcare startups, and let's discuss segment wise. So first segment is online pharmacy. So the best example which today we have for healthcare startup is 1mg. So 1mg is a startup in online pharmacy. Pharmeasy, then NetMeds, MyraMed, SastaSR. These are some of the examples of online pharmacy. Next is personal health management, MyUpchar, CureJoy. These are the examples of personal health management. Medical devices, we have UE Life Sciences, Forus Health, Beto, Wealthy Therapeutics, V Titans. fitness and wellness. Now here, as far as fitness and wellness is concerned, now as you could see, Fraternity is there, Healthify Me is there, CureFit is there, Health Card is there. See, even right now, most of the cricketers or even most of the Bollywood and other actors or the artists as well, they are right now investing their money on fitness and wellness startups. Say, for example, CureFit. CureFit has investment from Bollywood actor Hrithik Roshan. So Hrithik Roshan has invested 100 CR on CureFit startup. And CureFit, the founder of CureFit was the founder of Jabong.com. So what he did is he built a startup known as Jabong.com. Later on, he sold his startup to Flipkart, and then he started his one more venture, that is CureFit. And CureFit, he got investment from Hrithik Roshan, that too of 100 CR. Similarly, even Virat Kohli has invested in multiple startups. The best example, Mahendra Singh Dhoni. Mahendra Singh Dhoni, he has invested in a startup known as Dream 11. So Dream 11, we can see in the upcoming years to in upcoming 1 year, Dream 11 startup would be in the list of unicorn startup. And this is how, or at that particular level, it is booming like anything. Okay. Similarly, home healthcare category we have, and the name is Healthians. So again, one more cricketer, Indian cricketer, Yuvraj Singh. So Yuvraj Singh, he has invested 300 CR on a startup known as Healthians. Okay. Similarly, diagnostics, we have Niramai. Niramai is the exceptional startup for our Indian healthcare sector, because even recently we have seen a news from central government, the startup national startup awards. So national startup awards for healthcare category, Niramai is the one which has received a certification or the best startup award under for the central government. And Niramai is basically into diagnostics. Okay, we are going to discuss that as well in detail. Next is healthcare IT and data. Practo is one of that. Practo is the world's leading healthcare startup. Then Innovator is there, Healthflix is there, PharmaRack is there, Live Health is there. Telemedicine, we have one more, Practo, Libret, Docs App, MFine. These are the popular names in case of telemedicine segment. Now let's check out all the startups one by one. So first is NetMeds. So NetMeds is one of the biggest medical startups in India, and it is the India's leading online pharmacy as well. Okay, so right now they have their active customers and deliveries to more than 19,000 pin codes. Next is ImpactGuru.com. Now I will tell you simply what Impact Guru is doing. Consider a case where I have a friend and he has his relative and he needs 25 lakh rupees for a liver transplant, or he needs 25 lakh rupees for one of the surgery. Now what he is doing normally is he is posting that he should receive a donation from different NGOs or different CSRs, and he wants to arrange this much of fund for this liver transplant surgery. Now impactguru.com, now how this startup, it actually solves customer pain point. Now here what I have to do is I have to simply log in on impactguru.com and I have to just post along with all my medical documents and reports that this is the patient and he is not economically well and he needs 25 lakh rupees of funding through crowdfunding platform for this particular surgery. Now impactguru.com will verify this requirement from hospitals as well, and then impactguru.com will post on your behalf to all the social media network, to all the NGOs, to all the CSR, and they could collect a donation amount worth of 25 lakh rupees so that you can manage your own surgery expenses, and impactguru.com will reserve their own commission. Through this, over 20,000 patients have been benefited by 2 lakh donors from impactguru.com. So right now impactguru.com, which is a Mumbai based startup, and it is creating a value for customer, it is creating a value for patients. So this is a crowdfunding platform. Next is Docplexus, which is basically a aggregator model. Like you see, say, take an example of, say, Amazon or Flipkart. Now, what Amazon and Flipkart is doing, they are aggregating buyers and sellers on single platform. Similarly, what Docplexus is doing is, Docplexus is aggregating all the doctors from all the streams based on their specialization and all on single platform, so that doctors can interact with each other, they can complement each other, they can discuss the things with each other, they can share information, right? So this is how they are creating aggregator model for the doctors. So right now they have more than 2.75 lakhs doctors as its member. Okay, so this is completely a free platform, and they need to verify before they actually log in. So this is Docplexus. Next is Mera Medicine, which is founded by Pankaj Gupta, and they basically provide home delivery of medicine in 2 to 12 hours with a 15% discount. Mera Medicine. Care is one of the innovative startup in healthcare, and what Care is doing is, Care is basically what I say, MIS category, Management Information System. Now, what they do is, right now, whatever patients you see in OPD or IPD, so Care is basically store all the reports of all the patients. Now, suppose if I am undergoing a treatment at my town and I have stored all my documents on Care, and say, for example, next day I'm visiting Mumbai, so that the surgeon or the doctor who is there in Mumbai, he can easily access my document and he can see my entire case history right from the beginning. So Care basically offers you a convenience in this management information system. Next is Practo, and Practo could be the best example for student startups. Yes, because Practo is right now one of the world's leading healthcare platform, and it was founded by two second-year engineering students. I repeat, Practo is the best example of student startup, and it was founded by two second-year engineering students from NIT Bangalore in year 2008. So Shashank and Abhinav, both founders, both classmates, they we are studying in same class, and they could found one best platform which can be an aggregator for all the community of doctors and pharmacists together on one platform. So even if you want to book your appointment with a doctor or hospital, even you can do that, right? So right now they have over 2 lakh doctor profiles, they have more than 5,000 connected diagnostic centers in 35 cities. So Practo is doing excellent job. Now, after Practo, next is PharmEasy. So as we all know, even we have seen TV commercials on our cricket during our cricket matches as well. So PharmEasy is Mumbai-based pharma platform by Dharmil Seth, which has founded in 2015. So it is in online pharmacy. Next is BloodSure. Now, what problem this BloodSure is solving? So BloodSure was founded in year 2012, and this platform, it basically connects blood and platelet donors to those in need of real time. So right now, what BloodSure is doing? So BloodSure is a platform where you have to reach or you have to connect with this platform. So simply what we are doing, say for example, let's consider you have a requirement, urgent requirement of O negative blood group. So what you actually do is you create a message and you share it on your social media, your WhatsApp, and you ask your friends to share to more people, right? So simply what you have to do is BloodSure is aggregator of all the blood donors. So if you have a requirement of O negative in your own city, then you have to just log into BloodSure. You have to search for O negative from your nearest area so that you can get that blood donor immediately with no time in your own area, right? So right now they have a strong community, over 1.25 lakh active donors in India, and they could reach to more than 15,000 patients so far. Next is Niramai, the one which I was explaining in beginning initial part of my presentation. So Bangalore based startup is this, which uses AI for pain-free breast cancer screening. So normally a screening of breast cancer, the diagnostic method for breast cancer is not convenient. It is painful, and this is the reason why Niramai has developed this kind of technology, AI technology, and they are using this technology to detect breast cancer, that too in early stage. Right. So the screening device which Niramai uses, they can actually detect tumors 5 times smaller than what a clinical exam can catch. So comparatively, if you consider other screening devices which are there in cancer hospitals, Niramai has that technology as well as smart device which can capture all the tumor images in more better way. Right. So Niramai is the one which has received Best Startup of the Year for 2020. Next is Live Health, which is Pune-based startup, and this is again the best example in MIS, Management Information System. Now, say for example, let's consider we have a patient of say hypertension, or we have a patient of earlier history of heart attack or angina attacks. Okay, now here I have to monitor his entire health. Maybe say after every 3 months, I have to go with his blood testing, then cholesterol testing, then ECG testing. So what I'll be doing here is I'll be visiting pathology labs, and whatever pathology labs, the reports, whatever this diagnostic center is giving to me, Live Health is going to store in his own database. So say in a year, I did this testing for four times. Okay, after every 3 months, similarly for entire years, I did this checkup along with ECG and everything 4 times in a entire year. So at the end of the year, what this Live Health will show me the entire graphical representation of my entire healthcare, or all these reports, right? And also it will suggest me some of the lifestyle changes which I need to do based on my reports. Okay, so it may be cholesterol reports, it may be your insulin, it may be your ECG, it can be anything. Okay, next is emergency. Now emergency, what problem this startup is solving? This is one more Mumbai based startup, and what they are doing here is whenever you need emergency medical services, like you need doctors, you need nurses, ambulance, paramedics, first aid assistant. So at that point of time, again, the timing is important, because at that point of time, if you cannot have that emergency services with you, you may lose some of the patient at that particular point of time. So maybe during some of the accidental cases, we can utilize this emergency. So what this app is doing is, now, emergency basically has a data of all the doctors, nurses, paramedics, ambulances, and first aid assistants on their platform. And if suppose, say, I'm in Andheri is basically an area in Mumbai, and suppose I met one with an accident, so I have to immediately log into emergency and I have to initiate a response from that. So immediately the nearest emergency service team will come there. It will track your location through GPS, and till now it has responded over 3 lakh emergencies. Even because of this emergency services, emergency was recently funded by Ratan Tata as well. Okay, so right now they have their present in 50 cities. They have the funding of $2 million. Okay, next is Bagmo. Now Bagmo, what problem Bagmo is solving is, see, this is Kochi based startup, and it was started in year 2017. Now every blood donation, which is whatever we do, say for example, there is a requirement of blood in a small tiny village which does not have any blood bank, which does not have even the hospital. We need to think like how we think for telemedicine. So there are certain areas where even hospitals are not there, leave about blood banks and all. But whenever we have a requirement of blood in that area, how will you manage that? No doubt you can manage from your nearest town, but during the transit, the temperature or during this transportation and storage, there are the chances of having some fluctuations of temperature of your blood bag. So blood bag bagmo is basically a bag monitoring device, and what it actually does is it actually addresses the count or the temperature on their logify. Okay, and with the help of which you can maintain the temperature of blood bags throughout your journey. Okay, so this is a bagmo. Next is wafer chips techno solutions. So here you can see a device just like of a size of a pen drive. So this is basically a flagship device which can be easily used by anyone. Now whenever we have to have ECG reports and all, we can simply use this device which can be plugged into our smartphone devices as well, or even by using a Bluetooth you can connect your ECG with your smartphone. So this device again, it uses AI to generate a clinically actionable report for further diagnosis. So right now wafer chips, they have planned to price the device at 35,000 just for hospitals. EasyRx is one more startup, which is Kolkata based startup. And what they do is the test like anemia, jaundice, oxygen saturation. By using this kit, just in rupees 1, they are doing all these tests. Okay, so this is EasyRx. Mediasha is one of the startup which has been incubated at Bhau Incubation Center at Pune. So this is a Pune-based startup. What they are doing here is they have created a splint, orthopedic splint, and the brand name is Fracto Aid. Now consider a case, consider a school, and some children are playing in playground, and suddenly there is a student who met with accident and he has serious injury to his right hand. So immediately what we need to do here is we need to have a fracture for him. We need to have a plaster or splint for him, and it is not always possible in rural areas, right? Because this is where we need to again call ambulance, and then we need to have a certain journey towards hospital. Then we need to complete the entire formality and procedure, and then the actual treatment will begin. But what if our traditional or regular first aid kit will be provided with a splint? So this is the idea which Mediasha came with. So they have devised a membrane or a silicon membrane or silicon based material which is absolutely of a size of say consider handkerchief. It is a size of handkerchief, and you can keep it in your first aid kit as well. So immediately when you need such kind of treatment, what you have to do here is you have to just get this uh, silicon membrane, you have to soak it in water, you have to dry it, and you have to just wrap around that hand or wrap around that infected area. So within 3 minutes it gets settled down like an orthopedic splint, and within 5 minutes the functional strength, like how you have received your strength of plaster, it gets the same kind of splint within 5 minutes. So ideally this could be the revolutionary part as far as first aid boxes or treatment is concerned. Similarly, the same incubation center is devising some of the prosthetic organs, like prosthetic limbs, like prosthetic hands, like prosthetic ears, like prosthetic nose. So the people or the patients who have deformity in their ears or eyes or fingers, they can actually use this kind of silicon based prosthetic limbs or prosthetic ears. Next is Inito. Inito is a startup which was founded by two IITians, Ayush and Varun. And what this Inito is all about. So Inito is basically a device. So this is a Bangalore-based startup, and this allows all the diagnostic tests for vitamin, thyroid, and other lifestyle conditions as well on single platform. So now there is no need to visit pathology lab every time. So if you want to have your own thyroid test, what you have to do is you have to use this Inito device. You have to plug into your smartphone all the results, all the diagnostic conditions, all the lifestyle suggestions would be given by your application only based on the values which you have. Say for example, we have a diabetic patient, and usually after every month we need to test his blood sugar and everything. But what if we have such kind of device which can be tested along with a trend of data by using an AI and machine learning? This we can actually monitor at every stage of this patient's lifestyle, right? So this is a device, Inito. So that was the second part, and now we are going to discuss about pain points of the healthcare sector. So in first part, you have seen all the parts of Indian healthcare system. In latter part, we have seen case studies of different Indian healthcare startups and how they are working or how they are functioning. Now, third part will will tell you about the pain points of our healthcare sector. And the motive of this third part is like based on these pain points, then you can actually start thinking like how I can solve this problem, right? So this is where actually startups begin. So eventually, whenever you want to start a startup, you have to see what are the pain points of the customer and how I can solve this pain point by using my technology, by using my research, by using my innovation, or by using my service. Okay, so that you have to check. So we'll go one by one. Now, the reason why Indian healthcare is one of the very last industries to be disrupted by technologies is this reason that we cannot afford to experiment on our patients. No doubt today we can see there is excellent innovation going which is into computer technology, even in smartphones. Even we can see our Android gets upgraded every after 2 months and 3 months, right? Because they can actually experiment on their devices. They can have trial and error, but we all are healthcare professionals and we cannot have this trial and error system for our patients. And this is why Indian healthcare system is one of the very last industries to be disrupted by technology. So right now, India's population is reaching to 1.4 billion by 2025, but the fact is half of this will be at the age of 30. So you need to consider the age group, the demographic of your entire population. Almost 930 millions, they have the access to cell phones, even more than smartphones, but not to clean water. So this is again the irony of our country. No central regulatory authority of health ensuring services, and most of the citizens are uninsured. Like how we have health insurance policy in US and UK, similarly we do not have that regulatory authority to ensure healthcare insurance for all the patients. So that is one more gap here. So we have only one government hospital bed in every 2046 patients, while US has 345 beds, right? There is only one doctor, one government doctor in every 10,189 patients, while US has 24.5 doctors. 76% of Indians do not have health insurance, and this results in high out-of-pocket expenses incurred by the citizens of our country. A survey conducted later last year showed that 88% of patients would switch to another provider if they were not satisfied with the existing one. So we have now series of hospitals at metro cities. Right now we have specialists, we have super specialists, but the fact here is we do not have that assurance on our hospital or on our medical records. So speaking about the good things, what has been the biggest positive for the our healthcare industry in the last 5 years is, so the biggest positive has been the onset of technology and the ease with which people are willing to Google anything and everything. So probably you might have seen even we should introspect ourselves as well whenever we are in a waiting room of some hospital or clinic. before we visit any doctor, before we take consultation from doctor, we take consultation from Google. Consultation of this, so this could be a part of technology. So this initiative made doctors and the entrepreneur realize that there is an efficient, convenient way to make the patient pay for using their service. It should be always win-win situation. Don't try to cut the existing system or existing doctor-patient relationship. This patient should be there, but you have to see how you as an entrepreneur should offer a win-win situation for this condition. And last, remember that the primary objective of a doctor is to take better care of their patients, and everything else is secondary and ancillary. So what you as a startup founder, what you as an entrepreneur need to simply work on, like doing what the patient and the doctor wants, right? So doctor, he needs that doctor patient relationship, and patient, he needs a trust from a doctor. So you as an entrepreneur cannot come in between these two by breaking their, or by breaking their relation. You need to see how you can offer a win-win situation. Now coming back to the pain points of the customer. Now what after this session, or what after this orientation program, what you can do now is, or even whenever we offer different boot camp to multiple universities or institutions for pharmacy, what we do or what we suggest all these pharmacy institutions is, immediately what you can do here is, if the students are interested for startups and entrepreneurship, what they can do is, they can make a group of say 4 to 5 people. They can visit to maximum number of hospitals. They can visit maximum number of pathology centers, diagnostic centers, pharmaceutical industries, and upon visiting they can collect the problems of the customers, of the stakeholders. Now when I say hospital, we have different stakeholders in hospital. We have a patient, we have a surgeon, we have a doctor, we have pharmacist, we have nurses, right? We have receptionist, we have security. So similarly we have different stakeholders in our hospital. So visit each and every stakeholder, right? Visit visit a surgeon, visit a doctor, visit a patient, visit patient's relative, visit hospital pharmacist, interview them and ask for their problems, ask for their continuous pain points. Whenever they visit, they face this problem. Whenever I visit this hospital, I basically feel these problems. This should be changed. Okay, or how you can offer convenience to the entire system. So collect all these problems together, sit and brainstorm. Now, in an institution where we are doing all these things, there were 4 students. Every day they used to visit one hospital. They could visit all the stakeholders of hospital for a next for 1 week. They could visit some 5 to 6 different hospitals, right? At the end of the week, they could came back to our office and they had more than 400 problems in their list, more than 400 problems. Now the task was identify uniform problems, right? When, or the problems which are there in almost all hospitals. So you have to identify those common problems. So there were some 90 problems. Now again, identify the best challenging problem, or again, there could be 2 categories. One, problem can be solved for convenience, or problem can be solved for its need. So first of all, see to it how you can offer, or how you can create a solution to offer a need for that customer. That customer, it can be anything, or that stakeholder. So right now these students are working on only 3 problems which their technology can solve. Okay, so similarly, either hospital, either pathology lab, either pharma industry, you need to visit all these, you need to meet people, you need to collect their problems, you need to sit, you need to brainstorm yourself, and then you need to see how you can solve these problems, right? And based on technology or based on any kind of solution, you can create that. Okay. Number two, how you can create startups in your campus. Number two, every day we have some research work going on our herbal medicine, on maybe cosmetics, on maybe some of the nutraceuticals. See, these are the three which by using these three segments, eventually you can come up with very good startups. If you have any idea in nutraceutical or in herbal or in cosmetics, see to it how you can create at least a prototype or a working model or a sample for that. Okay. And then register your name, your team's name to your startup center, and then we will see how we can go ahead with your idea and make it commercialized. You get that? So ideally what I expect from your campus are two things. Number one, you can start from the scratch by visiting hospitals and all the stakeholders of healthcare. Or number two, see to it if you have existing products in nutraceutical or cosmetics or herbal, and we can see how we can commercialize it. Okay. So this is it. I can see, in case if anyone has any question, you can ask frankly so that we can have more discussion on that. And with this I conclude my session. I once again thank to all the faculty members and especially principal sir for arranging this particular orientation program for all the students, and we are expecting to come up with very good and innovative ideas from your campus. Okay. So in case if you have any kind of questions, you may ask so that we can have a discussion on that as well. Yes, now the forum is open to all of you. And if you have any questions, you may ask.
All the students, please do interact with sir and you have clarify your doubts regarding the startup center.
The question can be anything based on startup, or there could be few of the points where you are stuck and there you are expecting some solution or alternative, so that I can help you more on that. It can be anything.
Hello, sir. I'm Jay Krishna.
Yes. Hello.
I would like to ask on something related to IT technology, sir.
Uh-huh.
For suppose we have a problem in health sector, we identify it, and we have to link with the IT sector because it is easy for people to use the IT related apps.
Yes, of course.
So how can this be possible for a pharmacy students like us?
Yes. Very, very good question. I really appreciate your question. Okay, so all the students, I just repeat this particular question. Now, the question is, we all are basically pharma professionals. We are not app developers. We are not website developers. We are not now, question is how we can develop a technology based startup in healthcare. Now that's the question. Now here the interesting part which we are doing in our nearby university is Krishna deemed university we have, which is basically a medical university. So they have medical college, they have pharmacy college, they have physiotherapy, and they have other institutions as well. So the founders or the innovators, say for example you are two members of pharmacy institution and you have a great idea, but right now you need IT support. At this point of time you can do two things. For any startup you need a great team, and for this you need to identify such app developer which can be a team member for you. Okay. Now the startups which even we are creating, what we are doing is, for example, I need to create an application, Android application, and the budget part for this creating an Android application is, say, for example, 4 lakh rupees. Now, I am not going to invest my 4 lakh rupees in developing an application at initial part of the startup. But what I can do here is I can ask my app developer that if you are doing this, you can be a partner in our startup. So what we do is we offer him a co-founder, or we offer him a designation or a place in our own company, and we offer him some 10%, 15% stakes, or that is basically a revenue distribution. Okay. So we offer this, and so that he can be linked in our team for a longer period of time. Because if you are simply outsourcing IT services right now, but even after launching, you will require backend IT support, maintenance as well, and that time you cannot rely on outsourcing partner. So you need a team, or you need a developer in your team only. So identify that developer so that you can create a team likewise. Can we have next question? Yes, can we have next question? Ma'am, do we have any another questions?
Hello, sir.
Yes.
I don't think students are ready to ask any questions, sir.
Right. Now, even we have the same scenario whenever we have such kind of webinars for other institutions as well, be it engineers or be it MBA graduates. Even whenever we have such kind of sessions at classroom, even nobody is there to ask the questions. But immediately when we stop the session and when we walk out from our classroom, then eventually a group of students then will come and they will ask the questions in person. So that is the psychology everywhere. So in case if anyone has any questions, you can put down your questions to your coordinator team of Startup Center, so that during our weekly meetings we can actually discuss these questions. So in fact, we wish to see some 5 to 6 more innovative projects in your campus so that we can incubate them in more better way. Thank you so much.
Sure, definitely, sir. So shall we conclude the session, sir?
Yes. Sure.
So thank you so much, sir, for interacting with our students and also for conducting this orientation program on healthcare startups. And your session was so very much informative, sir, and it is very useful for our students to start their own idea. Thank you, sir. Thank you so much.
Yes.
And in
Yeah.
future, we expect more programs from you so that we can coordinate with you more in order to develop more products from our institution.
Yeah. Thank you